Uganda has joined the world to commemorate Epilepsy Day to raise awareness on the disorder. Epilepsy is a neurological disorder marked by episodes of sensory disturbances and seizures. This chronic non-communicable disease of the brain affects at least 65 million people worldwide, and in Uganda about 2.2 million people. Shakira Nasuna suffered epilepsy since childhood. Nasuna shares common epilepsy myths and misconceptions that people living with epilepsy still face.
Epilepsy is a demonic attack. The fact is, epilepsy is purely a medical condition. Fact is, epilepsy, mental illness, and intellectual disabilities are all conditions that affect the brain. However, if a person has epilepsy, it does not mean they have intellectual disability.
The Executive Director, Epilepsy Support Association Uganda, told the UBC the barriers of epilepsy to education and employment of patients of epilepsy.
There is a very high level of drug stockouts in our health centers in Uganda. And yet, a person with epilepsy, even just missing one dose, makes it a very big impact in their lives. So what they resort to and what we talk to them about is for them to have some sort of income generating activity which can make them afford to buy these drugs from pharmacies and clinics and wherever, such that they do not jump their cycle of drugs. However, a person with epilepsy in Uganda is one of the poorest in our communities.
Many children contracted the disorder at birth, as the disorder could also be caused by high fevers and malaria, as common causes among adults are linked to alcoholism and drug dependence.
At birth still, when a mother fails to push and they use a machine called a vacuum, where they push in a machine and it holds the head of the child to pull it out. That is a machine, and the scalp of the child is very soft. So at that point, as the machine is pressing the brain, the head, the brain is affected.
Nekesa advises on care and treatment of epilepsy and confirms that if diagnosed at an early stage, patients can cure and recover from the mental challenge.
It is the very first time that either somebody is saved or ignored. We want them to increase the budget for mental health, because in mental health, epilepsy stands number one. It's the biggest burden.